Today, the government of Saskatchewan has declared a provincial state of emergency, giving the government broad powers to address the COVID-19 pandemic. This is a responsibility that we take incredibly seriously and a decision that we do not take lightly. The declaration of a provincial state of emergency provides our government with powers that include the ability to limit travel to or from a community or a region of the province, and directing that a property or equipment can be deployed to address the COVID-19 pandemic that we are facing. The decision to declare this provincial state of emergency comes following confirmation from the Chief Medical Officer that Saskatchewan has 8 new presumptive cases of COVID-19, and this decision comes on Dr. Shahab's advice. This brings Saskatchewan's total of presumptive and confirmed cases of COVID-19 to 16 cases across the province. And Dr. Shahab will have more to say about that in a moment. Additionally, the government, in consultation with the Chief Medical Health Officer, is imposing a number of new restrictions to reduce the risk to Saskatchewan people, to prevent transmission of COVID-19 and to ensure that acute care services are preserved for residents that are most at risk for severe illness. So the following measures are effective immediately. Public gatherings larger than 50 people are prohibited. All restaurants, bars, and event venues must limit their seating to 50% of their capacity or up to a maximum of 50 people, whichever is less. All must be able to ensure social distance of 1 to 2 meters between the customers. Retail spaces, including grocery stores, pharmacies, gas stations, will be exempt from this policy. And I would also note that this is phase 1 with regards to bars and restaurants, and we may implement phase 2 in the coming days, which would be closing them completely, except for takeout and delivery options. All gyms, fitness centers, casinos, bingo halls are all ordered to close until further notice. Residents are advised to limit any non-essential travel outside of the province of Saskatchewan, with the exception of people who live in border communities and are commuting for work. All Crown utilities will implement an interest deferral program for up to 6 months for Saskatchewan residents who are unable to make bill payments due to the impacts of COVID-19 restrictions. And all government of Saskatchewan ministries, agencies, and Crown corporations will implement a phased-in work-from-home policy that will become effective on Monday, March the 23rd. This is applicable to employees that are deemed non-essential, and this means that any employees that are able to work from home will be able to do so, while providing managers a period of time to ensure that we have workforce continuity. The Saskatchewan Health Authority will be discontinuing all non-urgent elective surgeries and procedures and diagnostics as of March 23rd. This action will allow the Saskatchewan Health Authority the ability to redeploy nurses and other staff to ensure that medical supplies and personal protective equipment are available when needed, and to reduce the risk of further exposure to not only our healthcare providers but our patients. The Saskatchewan Health Authority will continue to provide services to patients who require emergent and urgent care. Cancer, urgent and emergent surgeries will continue as planned, and patients will be contacted regarding their scheduled services. Finally, parents with children in daycare should also be preparing for the potential for further restrictions in the days ahead. And I want to conclude by saying this to the people of this great province. We will get through this, and we will get through this together. But we all have a responsibility, and we all have to take that personal responsibility seriously. And I would say that most of us are doing that. But I have heard some anecdotal reports of people that have returned home from abroad and who are out in the community the very next day. And we just simply can't do that. We need to self-isolate. And I know you may say that you're feeling just fine, but you might be endangering the health and the lives of others. Your neighbor, possibly, or even an elderly family member. And I know this is completely counterintuitive, especially here in our province. In times of crisis, we are a community and we pull together as one. We've shown that so many times. But today, pulling together means we need to stay apart. It means taking extra precautions like washing your hands more often than you otherwise might, and practicing social distancing. It means self-isolating for 14 days when you return from international travel, and that is so important. If you are feeling healthy and you haven't been traveling or you haven't been exposed to someone who has tested positive, I would offer you this. You can help by delivering groceries to a friend, to a neighbor, or to a grandparent who may be self-isolating on their own. We need to look after one another. It means buying what we need at grocery stores and not hoarding. And I will repeat precisely what I said the other day. COVID-19 will not cause shortages in our grocery stores, but hoarding will. So don't do it. But most importantly, helping each other out during this pandemic, it means listening to Dr. Shahab and his advice that he provides, as well as his counterparts, public health officials from across Canada. And this means each and every one of us should adhere to the advice that they provide us. We are taking action in this province on the very best advice from some of the very best medical professionals in the world, but it simply will not work if we do not follow it, each of us. It's important for us to understand that these measures will not completely prevent the spread of COVID-19, but they will flatten the curve. And it's only together, if we take this situation seriously. And that's what I'm asking each and every resident of this province to do, is to take this situation very seriously. As individuals, we all have a personal responsibility to ourselves, to our family, to our community. We have a personal responsibility to this province and to this nation. In closing, I would just like to thank each and every worker that is providing an essential service in Saskatchewan today. Doctors, nurses, healthcare technicians, paramedics, police officers, and firefighters. The work that you do, it's of the utmost importance each and every day, but I think it's even more impactful during this time of tremendous uncertainty. And to the truck drivers and the grocery retailers and the pharmacists and all that are playing a critical part in our supply chain and our communities, thank you for keeping our shelves stocked, and thank you for keeping our fridges full and our families fed. And to all of the people in this great province of Saskatchewan, I would say this: we will get through this, and we will get through this together.